Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho lost more than 2,000 farms over a 5-year period. Idaho Matters wants to know how that's impacting farmers, cities, and counties. Listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons through November 17th in the Idaho Matters podcast feed. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Canada has officially lost its measles elimination status after more than a year of ongoing outbreaks, which means measles is once again considered to be spreading in Canada regularly. And that's raising concerns on our side of the border as well. It's Wednesday, which means it's time for our Doctor Roundtable with Dr. David Pate. Of course, he is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, you can always send us an email, idahomatters@boisestate.edu. So, Dr. Pate, how exactly is elimination of measles defined by bodies like the Centers for Disease Control and Prevention or even the Pan American Health Organization?
Yes, what they do is they look at the measles activity, and if there is ongoing spread of the same strain of the virus for 12 consecutive months, then you lose your elimination status. And that is what happened to Canada. The measles outbreaks that they've been having have been looked at the measles virus. They can tell that it's all connected. It's the same virus that's been spreading for more than a year now. And so just as you and I discussed a few weeks ago that we thought this was likely, it has in fact happened. And I suspect we may be facing the same thing next year for the United States. That would be truly a major disappointment.
So I want to get to that in a minute, Dr. Pate. But before then, so when a country like Canada just went through this, when it loses its elimination status, what are kind of like the practical public health implications? And I'm talking like immediate health implications, but maybe longer term as well.
Well, the first implication is that if the country has allowed this to go on for 12 consecutive months, obviously they're not doing enough. There's some kind of a problem. And of course, with measles, we know what that problem is, and it's under vaccination rates. And so the first thing is that it means that the public health needs to do something different because obviously what they're doing is not working. In Canada's case and our case, a lot of this happens to revolve around vaccine disinformation, people being more scared of the measles vaccine than the measles disease, not understanding the problems associated with the measles infection. And so health authorities have to deal with that. One of the big consequences is that for doctors' offices and hospitals, prior to this year, we didn't have to spend a lot of time worrying about someone showing up in our facilities with measles, which is highly, highly contagious and could place a very significant risk to our other patients and families. And so we didn't have to worry about that too much. Now we have to worry about it. How are we going to handle this if somebody shows up? How can we contain them, keep them from infecting others? The other consequence is that just as we do in our country with looking at travel advisories, now other countries will alert their citizens that, hey, there should be a travel warning about going to Canada because you would face a risk of measles. And this is particularly concerning for pregnant women and also for people that would be traveling with young children who are not eligible for vaccination yet.
Okay, so you mentioned we might be looking at this here in the United States in the next year. So we should note that we have had a rising number of cases and outbreaks just in 2025 here in the US. I mean, I believe the CDC says we've had to date 1,681 cases reported in the US. And those are just reported cases, Dr. Pate. So, what is the risk of elimination status here in the United States? And if we lose it, I mean, what does that mean, for the US, but in particular, I'm thinking like Idaho, we're a border state, right, to Canada. And so how would that potentially impact, those of us who live close to the border?
Yeah, so I feel like it's far more likely than not likely that we are going to lose our elimination status. I would
Mhm.
expect it would be sometime in the spring to summer range next year that we'll lose our status. And that's a sad day for all of the health advances we've made in this country. The Americas were one of the first countries to eliminate this virus. We're now going to be among the first to lose it. And that's a real shame. So it certainly it harms our standing in the world. People have long looked to the United States as one of the exemplary countries for public health. Now we're being looked at it almost a laughing stock for public health. And so that's a
Mhm.
shame because we have a lot of influence. The other thing is that we're going to face more problems with children's hospitalizations, disabilities from measles, and even deaths. And so this is going to be a terrible shame when it happens. And it probably will affect tourism to the United States. It probably will make a difference. And so, that's not something we need for our economy either.
So I have to say, I mean, I remember when we got that elimination status 25 years ago. And, thinking about the fact that we were likely to lose that status, as you said, within the next 6 months or so. Is there any actions that could be emphasized right now to prevent the loss of status? I mean, I mean, vaccines, right? I mean, could that happen? I mean, or are we basically already on that path for losing this status?
Well, we're definitely on the path, but it is not too late. But what it would require is the current administration, backtracking on a lot of the disinformation that, frankly, they have promoted. And of course, now we've got the state of Florida completely eliminating vaccine requirements for schools. That's going to make it worse. So, we've teed all this up to be the recipe for losing this status. I think that if President Trump and RFK Jr. were to come out very strongly and say, look, this was wrong. The measles vaccine is extremely safe, which it is. We've been using it since the 1970s without, actually before that, without problem. And measles is not a disease to just be assumed everything's going to be okay. In fact, a lot of children go through unnecessary harms and even deaths. Now, my confidence that that's going to happen is pretty low, but I never give up hope. I'm always an eternal optimist. I'm always a glass half full kind of guy, and I hope that we can realize that this doesn't serve the Trump administration or America's interests in the long run, and so
Mhm.
hopefully we can do something about it. I just feel likely that that won't happen.
So I want to turn now and let's talk about the upcoming flu season. So, Dr. Pate, is there anything that we know yet or that we can think about in terms of our flu season, given what the Southern Hemisphere just experienced with its flu season, since they go through flu season before we do?
Well, exactly. And as your listeners know, I always follow what's going on in the Southern Hemisphere because it helps me to be able to predict what we might be in for. And unfortunately, this is not good news. So, Australia had their worst flu season last year
Oh.
since about 2001. And this year, it is about 19% worse. And so I think this is evidence that we're likely going to have a very severe flu season. In addition, it's not just Australia, but now we're even, as it's starting to be flu season in some parts of the Northern Hemisphere, we are seeing, for example, in the UK, start to see some pretty serious activity. We also know that China and Japan have had a very severe influenza. In fact, both of those countries have had to close schools temporarily, trying to slow down the transmission of influenza, because that is, we've known for a long time that it's school children that acquire influenza, bring it to homes, and that's what spreads and causes the
Hmm.
influenza epidemics. In addition, there was something, so we saw some peculiar activity. First of all, the flu season was starting earlier in those countries. And in the UK, it's like almost 2 months early for them that they started seeing their activity. So that was of concern. Then what we just determined at the end of the summer is, unfortunately, there is one of the strains that is circulating is what we call an H3N2. No, in most years, we have H1N1. This is an H3N2 virus. And unfortunately, because of the significant transmission, it has mutated significantly. And so we are very concerned. The last time Americans really got exposed to H3N2 was 3 years ago. So we
Hmm.
don't think they're going to have very much immune protection. The good news coming out of the UK is that they have already tested the vaccines against this new strain of virus. And in children, it reduces the chances for severe illness 70 to 75%. For old adults like me, it reduces it 30 to 40%. So I think the most important thing is get your flu shots. I would get them now. We have started, the activity in the United States is still very low, but we have started seeing it go up. And what we saw in these other countries is it went up quickly, which
Mm.
quicker than usual. And then in Australia, concerningly, when the flu season starts early, you also expect it to end early. However, it has had a long tail in
Oh.
Australia still going on. And it seems to be at this point really causing problems in adolescents and young children. Please don't underestimate this year's flu strain. Please, if your children are 6 months and older, please get them vaccinated. Make sure that you get vaccinated. Remember, even if flu doesn't make you severely ill, for adults, it does increase our risk for heart attacks and strokes afterwards for a period of time.
Hmm.
And so do get the flu shots, and I would get them now.
Okay, so definitely get them now. And I tell you, Dr. Pate, I took your advice a couple of weeks ago when my kids had doctor's appointments, and the pediatrician asked if they wanted their flu shots, and I was like, "Well, we're waiting a couple more weeks." And both of my kids were like, "Can we just get it done now?" And I was like, "Sure." So, and then my husband and I got them last weekend. So, took your advice on that. Like, if you know they're gonna, if they don't want to get them one time and they're willing to get them, just go do it.
Exactly.
Some really big news in regards to treatment for menopause. The FDA yesterday removed the black box warning label for hormone replacement therapy. So, can you start out by telling us what exactly was the announcement that the FDA made and why is this such a big deal?
Right. So this is a big deal, and it's one that's being well received by the medical community at large. So, first of all, black box warning is a step that is taken by the FDA that tells manufacturers and distributors that they must put this warning, and it's a prominently visible and worded warning on the packaging of whatever particular medication. And in this case, it was a black box warning that was issued in 2003. It was based on a landmark study in 2002 that looked at a very large population of women from the Women's Health Initiative that suggested that women, particularly older women who took estrogen, were at increased risk of heart disease and breast cancer and when they were postmenopausal. And so the black box warning was for all those hormonal products.
Hmm.
What happened with this recent announcement was that the FDA said they were going to remove that black box warning, except for the estrogen by itself for women who have intact uterus, because we do know that unopposed estrogen is not good in that situation. It needs to be combined with a progestin type drug. But otherwise, they're removing the black box warning. And that's
Hmm.
really good because we do think the risks are probably overstated. They are real risks, but they are probably overstated. And the black box warning has been a real inhibitory factor for doctors being feeling comfortable prescribing estrogen for women, and especially in view of a recent study that you and I discussed a few weeks ago, where there actually is a lot of benefit to giving women, particularly before age 60, estrogen replacement
Hmm.
for menopausal symptoms. So it was a good day.
Well, and we should say, Dr. Pate, that those warnings were first added after there was some study that linked HRT to higher cancer risks. And oh, I mean, the science has really changed since then, right? I mean, and in a way, it feels like women have been fighting for HRT for so long because this study said, well, HRT isn't good for you. Yet, over the last what, 2, 3 decades, I feel like women, of course, have been advocating and fighting, as I said, to try to get the treatment that they need. And as you just mentioned, this is going to make it so much easier, hopefully.
Oh yes, and many doctors fighting for this as well. The black box warning is just really a major weight on physicians prescribing, because if for some reason a person does develop that problem, that is going to be a terrible liability in a lawsuit, knowing that
Mm,
there's this black box warning, but also because responsible doctors don't want bad things to happen to patients. So, so this is going to be a major improvement. And the other thing that has to be considered is that we have different preparations of these hormones. The risks for taking oral estrogens and progestins are much different than, for example, the topical, the skin patches, the
hmm.
vaginal products, those kind of things, which have these latter ones have far reduced risks. And so a treatment can be individualized based on what's going on with the woman in terms of their history. Have they already had breast cancer? Have they had blood clots before? There's a lot of factors that doctors need to take into consideration, but it gives us a lot more leeway now. And I do think that this will be overall a good move for women, because we know that, for example, estrogen is very important for bone health. We know that
Hmm.
when given, particularly to that younger age group, that it can actually be cardioprotective. So this is good.
Well, and I thought it was interesting too, Dr. Pate, that the FDA commissioner called the old warnings, and I'm quoting, one of the greatest mistakes in modern medicine. What were your thoughts on? I mean, that's a strong statement.
Yeah, I mean, I don't think we need to over dramatize things.
Yeah.
That decision in 2003 was made in good faith, uh, with the information that was available at the time, with
Mhm.
the idea that we don't want to harm women. And so it was not an irresponsible decision. I think what the consequence of it was, though, that having that black box warning meant that no large randomized trials were done since then, because how are we going to do that
Mm.
now after you give that black box warning? And so there should have been much more study. I think also it was kind of a blanket approach to a situation where there are so many variables that you have to consider with each particular individual woman as to what their risk factors are, what their medical history is, how do we individualize the treatment? You need to consider, do they still have their uterus? There's so many factors that go into this that it was just an overly broad reaction. And I think at a time when, frankly, this same FDA director has done a lot to harm confidence in
Mm.
public health, I think that he doesn't need to be making those. I go back to the old show Dragnet. I don't know if your listeners remember Jack Webb, but just the facts, ma'am. And we don't need to have those kind of editorial comments from the FDA director, in my judgment.
Well, and speaking of comments that could be, lots of misinformation. A couple of months ago, and you and I have talked about this on the program, is when the director of Health and Human Services said, Tylenol use in pregnancy is linked to autism. Well, a review of acetaminophen use during pregnancy was just released in the last few days, Dr. Pate, and it does not clearly link it to autism or to ADHD. So, can you break down what researchers actually found?
Yes. So we talked about on your show that when President Trump and RFK Jr. came out and were telling everybody, don't take Tylenol if you're pregnant, and yeah, we've got we've got the evidence it causes autism, all that stuff. In fact, at that time they had no new evidence, and in fact, the evidence that existed didn't support what they were saying. So all of us were kind of scratching our heads, figuring out, where did this come from, and why is the president making those kind of public statements right now? And in fact, subsequently, RFK Jr. did indicate that he did not have evidence to support that statement, which was really a terrible mistake. After that, you and I talked about on the show that there was actually a big study that followed large numbers of people. I believe it was Denmark. And it was a study that really showed good evidence suggests that there is not a causal link. What you and I discussed is that Tylenol has come up as a possible association, but association is different than causation. And not surprisingly, because we do know that infections and fever in pregnant women do pose a risk to their unborn children. And so, what do? If you have an infection and fever? You take Tylenol, but it's not Tylenol causing the problem, it's in the infection and fever. So what happened is this most recent study is they went back to look at all the data again, all of the clinical trials that have been done
Mhm.
to try to make sense of this. They put the information together. They rated the quality of the studies, of which most of them were not particularly very good. They didn't have good controls. And in fact, what their conclusion after looking at all the evidence is, no, there really is no indication of causality. There is nothing from the data that could lead any responsible physician to say that you have to be careful of be taking acetaminophen or Tylenol in pregnancy because it might lead to autism. We have no evidence of that.
And in fact, Dr. Pate, the study's authors raised concerns about misinformation leading women to avoid necessary treatment. So you talked about the real risks, right, of not managing a fever. Can you talk a little bit more about that? Because I thought that was so interesting that these authors, literally stated misinformation is what could really be detrimental.
Well, absolutely. And, rightly so. Over history, when our president tells us, hey, be careful of this or don't do this, I mean, we listen to that. That gets a lot of press, and is a very effective way to get information out. Unfortunately, in this case, that information was based on nothing. And so people are getting the wrong information. And what our concerns are is that pregnant women may do one or both of two bad options. One, if they do have fever, they may take a different medication. We know that of all the potential medications, acetaminophen is the safest for unborn children, but they might decide instead to take, for example, ibuprofen, something like that for their symptoms. Unfortunately, we do know that those medicines are associated with real potential harms to babies. So that's one concern. The other is that they just won't treat their fever. And we have long
Mm.
established that fever, if high and left to go on for a while, does interfere with certain neurodevelopmental changes in that unborn child. So both of those would be bad outcomes. The bottom line is, do not listen to the issues that have been brought up by the president and RFK Jr. about Tylenol and pregnancy. Even RFK Jr. has admitted it was based on no evidence. Second, talk to your obstetrician or whoever's providing your
Hmm.
maternal care. They will tell you what to do, what to take when you have a fever or an infection.
So I want to get to a listener question, Dr. Payton, our last few minutes, because Liz wrote in and she says, since I have no faith in the CDC, which organizations can I trust for fact and scientific based information?
Well, Liz, it's a great question. I could better answer the question if you could tell me what specific type of information you want, because unfortunately, I don't know of a website that has everything that, for example, I need. I go to many, many different websites, but let me give you a few in case this might be what you're thinking about. First of all, if you have questions about vaccines, you're trying to understand vaccines, a really good a website for parents that want to check out vaccine questions about their kids, healthychildren.org. That's by the American Association of Pediatricians. That's a very respected organization, good information, easy to understand. Probably the be all end all website for vaccine questions would be the Children's Hospital of Philadelphia website, which is chop.org. And if you want to find the vaccine center, go to chop.edu. They have a lot of information. If it's about you want to know about public health things happening in Idaho, our Idaho Department of Health and Welfare website is something I go to all the time. It has lots of good information, especially about new and emerging things. If you're trying to look at wastewater levels, I go to waterscan.org. If you want to know about a health issue that our legislature is contemplating, the Idaho Medical Association puts out white papers. I've been involved in writing some of those, and we write those for legislators so that we can inform them. So it's meant for people that are not physicians, and you can find that at the Idaho Medical Association website. And if you want to know about these issues for pregnancy, I go to ACOG, which is the American College of Obstetricians and Gynecologists. They have great information. If it's some of the weird diseases that we talk about from time to time on this show, you can go to the World Health Organization website, and they usually have some very good information. But Liz, if I didn't find the area that you were interested in, write back and tell us specifically what you're looking for, and I'll try to come up with a good website for you.
And I would just also like to plug Dr. Pate's blog if you would like information as well. Because Dr. Pate, I think you do a not only here on our show, but keeping your blog up to date as well and all of the information you put out there. So
Oh,
just
thank
wanted
you.
to put that plug in for you.
Appreciate it.
Absolutely. Always, Dr. Pate. We've been talking with Dr. Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question like Liz did, send us an email, idahomatters@boisestate.edu, and we will do our best to get those answered for you. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.